Hi everyone, I'm back and today's video is a bit weird, right? The healthcare system in the US versus the healthcare system here in Germany. So why would I, an Asian and never been to the US, be interested in their healthcare system? Well, the reasons are the combination of so many things. Firstly, as I came here in Germany, I started paying 90 euros per month for my healthcare insurance. I was like, why do I have to pay that much of money for only insurance? Because I paid 20 euros, let's say 20 euros, for my insurance in Vietnam. And that was not only for a month, that was for the whole year. So I was intrigued by the healthcare services in Germany, which is known as the national healthcare system. Secondly, my professor at university, to be honest, is not a big fan of Donald Trump. Yeah, he usually, occasionally inserted his opinions on how the American government is regulating their country. And recently it was about his trip to Chicago during the last Easter holiday, and he said that a lot of homeless people staying outside and got frozen to death because the American government let them be responsible for their own health care. And I was like, what is going on there? To be honest, I'm not a big fan of America. Sorry, but yeah, I'm not really into the American dreams or all that sort of thing, so I had no idea about their healthcare system. And the last but not least, the healthcare system in the US is now a controversial topic in Reddit. I saw a lot of posts about it. Recently, there was a guy posting the bill of curing his 8-inch cut on his wrist, and it costed him like almost 36,000 US dollars. Seriously, it's insane. So I made up my mind that I gotta know about their healthcare system, like what is happening over there, and if the quality of services is worth what American citizens pay for them. And as I'm living in Germany, I hope that I could have a chance to make a reasonable comparison with the German healthcare system, which is a representative of the national healthcare system. However, before start, I'd like to say that I'm no expert in this field. I'm just a tiny person who is curious about this topic and trying to wrap my head around it. So if you also like me, then let's go. So the first thing I noticed was that the healthcare in America is mostly provided by the private sector. Only some hospitals are run by the government. Also, almost all the physicians work for the private sector too, and other components like pharmaceutical companies or the medical device providers also in the private sector. Whereas in Germany, the government runs the healthcare system, and as German citizens and people living in Germany, you have to pay a monthly statutory contributions in order to ensure the free healthcare for everyone. Well, as a student under 30, I have to pay 90 euros per month for my contribution, a TK. Secondly, in Germany, around 87% of German population get the statutory health insurance, and it provides you with the same care whenever you get ill, whereas 11% of those get the private insurance. Those people are probably really rich because it provides them with special treatments, so to say, upon their request, like special treatment by the senior doctors or private hospital rooms and all that sort of thing. And yet you need to have the income which is above 59,400 euros per year or 4,950 euros per month as in 2018 to get that kind of private insurance. And in America, around 10% of the under 65 population are uninsured, the data from 2016. And why are they excluding the over 65? Because they have something called Medicare for those people, which is considered the closest thing to the a single payer system that American people are insistently asking for. Well, and the 10% we're talking about equals like 27 million people. They are uninsured. What a big number. As a result of our private healthcare system, the healthcare in the US is extremely expensive. Let's take a look at the bill of the guy from Reddit. He claimed that he had an 8-inch cut and it costed him like nearly $36,000. Let's pay attention to the X-ray test. It costed him $340, $459, and $590 for those. I haven't had a chance to take an X-ray here in Germany, but I watched this video from this dude. He said that it costed him only 20 euros, sorry, for the X-ray in Germany. Mönchengladbach in particular. He didn't have any insurance at all, and he's an American. And also he was really surprised because his visit to the emergency room only costed him like 60 euros more, so 80 euros in total for the X-ray test and the emergency room. And he also mentioned that if he was in America without any insurance, it would have been like $500 for the same procedure, the same things that he had in Germany. And look, the emergency room costs this dude over $5,000. Unfortunately, I didn't know like how long he stayed there or what made that cost so much. So now I'm concerned here because with such high prices for the healthcare and 27 million people without any insurance, how would they pay for the healthcare when they're in need? What actually drove the US healthcare price that high? Maybe because of the thought that if you want something done right, you give it to the private sector. But in this case, it doesn't work as efficiently. I really like how Vox explained it. They basically say that when it comes to healthcare, we consumers have the least bargaining power. Like, we come to the hospitals when we ill, and we can't say no to that sort of thing. And in Germany, the government says no for us. Like, they negotiate the price with the pharmaceutical companies and stuff. And if those companies want to provide services to German people, they have to accept that price. And meanwhile, in the US, that bargaining procedure belongs to the private insurance companies. And yet, they can't be as powerful as the government. As a result, the drugs and healthcare services are much more pricey in America. Some examples. Some more facts about the US healthcare system. As a percent of the economy, Americans spend much more on healthcare than Germans. 17.7% versus 11.3%. However, they visit doctors less than us in Germany. But they pay more for the drugs and healthcare services, as I said earlier. And one more interesting fact that I read, that they pay the doctors based on the number of services that the doctor provides, not the outcomes of the patients. Like, or according to Vox, that their income largely depends on whether or not they perform the surgery regardless of the patient outcomes. And finally, let's look at how the healthcare system in the US and Germany perform. As I know more about it, the healthcare system in America and here in Germany, I feel even luckier to have a chance to live here in Germany. Oh, thank you guys for watching my YouTube video. If you like it, please give me a big like and don't forget to subscribe. See you next time. Bye.